for educational and informational purposes only. This is not legal, clinical, medical, or financial advice. So please verify all regulatory requirements of your institution's legal or compliance office. Mention of policies, agencies, and legislations does not imply endorsement, and this episode does not establish a consultant client or provider patient relationship. So, our acronyms will be spoken in their full form at least once for clarity. All right, so welcome to the Behavioral Health Talks with the Behavioral Health Queen, Dr. TK. I'm Dr. Trained Tonight, Doctor of Behavioral Health, and your guide to build systems that are compliant, resilient, and designed to support the whole student, the whole staff member, and the whole institution. Today, we're covering major updates. Updates in FERPA, which is the Family Education Rights and Privacy Act, HIPAA, the Health Insurance Portability and Accountability Act, Title 42 Code of Federal Regulations, and that's part two, and the Youth Mental Health Crisis, Integrated Care Expansions, and attendance as an early warning sign, and big changes to federal student loans. And yes, I'll give you concrete actions you can implement this week. So go ahead and visit my website at www.virtuallyrenownedconsultingaccessllc.org, or you can contact me via email at tnight@virtuallyrenownedconsulting.onmicrosoft.com. First up, FERPA flashpoints. Okay, so you guys heard me talk about this a lot. So let's start with FERPA because FERPA is having a moment. So on February 5th, 2026, the Student Privacy Policy Office at the United States Department of Education issued a letter warning institutions about potential FERPA compliance risk linked to the National Study of Learning, Voting, and Engagement known as the NSLVE. This means do not use 2026 data from that study until the federal review is complete. All right. So next, the Student Privacy Policy Office also released findings on January 28, 2026, that the California Department of Education violated FERPA by pressuring districts to withhold student information from parents. The message is clear. The federal student privacy rules win every single time. All right. So, what you must do this week is pause any use of the NSLVE data, recheck all data sharing agreements, retrain staff on what counts as an education record, and redirect your team to the Student Privacy Policy Office Resource Hub. Okay? Now, if FERPA were a person, it would be the only quietly highlighting line 17 in your data sharing agreement while sharing or staring directly into your soul. So respect the highlighter at its best. Okay. Next up, HIPAA Part 2 enforcement. So next, the world of healthcare privacy just leveled up. February 16, 2026 was the compliance deadline for the federal alignment of Title 42 Code of Federal Regulations Part 2 with HIPAA. And now the Office for Civil Rights is actively enforcing it. So compliance are open, model notices are live, and breach reporting applies to Part 2 records. So what does this mean? Update your notice of privacy practices, update your Part 2 patient notices, and update all business associate agreements. Train every department that touches health, mental health, and substance use information, including athletics and telehealth vendors. Yes. Also, watch for upcoming HIPAA security rule updates later in 2026. It's an enforcement date yet, but you do not want to get caught unprepared. All right. So if your staff still pronounce redisclosure like it's a Greek methodical creature, it's time to get training. All right. So next up is youth and campus mental health. Now let's talk data and let's talk youth mental health because the youth is basically where a lot of our data comes from. In regards to the adolescents, children, early, and that crosses over into the early adulthood phase of higher education institutions that bring in students of that age range. So in January 2026, the Centers for Disease Control and Prevention launched a mental health data channel. So it shows 99% of high school students say their mental health was poor most or all of the previous 30 days. 19% of adults have been diagnosed with depressive disorder, and peer-reviewed research from the American Academy of Pediatrics shows persistent sadness near 40% in recent years, with an alarming increase in suicidality. The Journal of Adolescent Health noted slight improvement since 2021, but emphasized the need for systemic support, not just awareness, and that is the truth. We have to do more with addressing the factors that are imposed on adolescents. Those include how we address the bullying, how we address the academics, how we address the rules and guidelines and regulations around appearance. Yes, how we address parents and their issues of society that does impact the kids. How do we help the parents so that they can stay in the homes and be parents? Telehealth Insights virtual therapy for college students shows high rates of reliable improvement and remission and minimum racial disparities when programs are implemented well. And we can say that with everything, but a lot of times it is assumed it's implemented well, only to find out that there are gaps in areas that need improvement. So, consulting and coaching services should be used at a massively fast amount and effort for organizations to make sure that these areas are highlighted. To assume that your program is implemented well is not a justice to those that is impacted when things are not implemented well. So, digital mental health tools, more than 80% of digital interventions show partial or full effectiveness, but adoption and equity gaps remain. This is your moment to use evidence based digital supports with intentionality, not guesswork. And I like to talk about digital supports in regards to AI because it has been the greatest tool ever. You will hear me say, we are constantly trying to make it appear as a negative, but what I had to learn is we try to make everything appear to be a negative when it threatens something about us. So don't show society that you're threatened by attacking it, okay? Show society that you are willing to grow and learn and know that everything comes with their level of imperfections. All right, so integrated care bills is our next segment. And integrated care is expanding across the country. So in Virginia, Colonial Behavioral Health received $2 million to develop a fully integrated campus, behavioral health, primary care, dental, and pharmacy services under one roof. All right, Virginia. In Delaware, Christian Care is building a $65 million integrated health campus with outpatient, inpatient, emergency, and behavioral health services. All right, great job to Delaware as well. And across California, multiple Be Well integrated campuses are being constructed through behavioral health infrastructure funding. So your opportunity here is to create memorandums of understanding with these community systems, secure warm handoffs, and enhance after hours coverage and deepen clinical training pathways for your students and staff. The thing here to learn is that these programs have grown and obtained funding because the actual student higher education campus came on to support its growth and outreach throughout those states. So that is my goal. All right. Next up, attendance as a health signal. I say this often, attendance is a health signal, not just an academic one. Research from Frontiers in Education frames absenteeism as an early warning signal of academic, social, emotional, and physical instability. Now, the University of North Carolina research shows that every absence directly correlates with learning loss. In 2024, a study and research in higher education found that early alerts don't boost grades on their own. Alerts must be paired with immediate human support. And realize this, a 2025 study in the Journal of Applied Sciences found that early alerts can trigger negative emotions, but also can increase motivation with paired when paired with supported language and actionable steps. Now let's take a look at your playbook. Make early alerts human, make them warm, and make them fast. You're not in trouble and you're not alone. Here's your next step, and here's your person. When we take a look at UK and global well-being updates across the Atlantic, the UK United Kingdom continues to lead in whole university well-being frameworks. So University College of London released its staff mental health and well-being action plan for 2026 through 2028. Student Minds retained over 100 universities in its university mental health charter program, signaling continued commitment to creating emotionally healthy campuses. The National Health for Health and Care Research funded a new mental health research group in Lincolnshire to address rural and coastal disparities. Pair this with the World Health Organization's guidance on mental health reform, and you have a global blueprint for building mental health centered institutions. So next up, student loan changes for 2026. Finally, let's talk student loans. Oh, how do I despise the system? Um, love the loans because they help individuals such as myself obtain my education, but the process is horrible. So, under the One Big Beautiful Bill Act, the Department of Education issued new proposed rules in January 2026. The major changes included eliminating the Graduate Plus program, setting annual caps for borrowing, $20,500 per year for graduate students, $50,000 per year for certain professional programs, and reducing repayment plans to just two options, offering a new repayment assistance plan. These changes take effect July 1st, 2026 for new borrowers and for the borrowers who consolidate loans. Your institution must restructure graduate funding models, prepare simple one page guides for students, and offer financial wellness support aligned to these new rules. This is a retention issue, is not an equity issue, and it is a mental health issue. When we look at student loans in general, creating these processes and flows is helpful, but they can also be harmful to those that already have loans and isn't making income or have low income. And various different things has to be taken into consideration in hopes by our Senate and government. So here's a rapid fire checklist for you guys. Here's your to do list. And go ahead and do these things now. First, freeze your use of 2026 NSLVE data. Update HIPAA and Part 2 notices and agreements. Pair early alerts with human contact within 24 hours and evaluate your digital mental health tools for equity. Prepare your campus for the 2026 student loan overhaul. If this episode felt like drinking from a policy fire hose, I've already organized it for you. So go ahead and reach out to me if you need me to provide you with this checklist again, or you can just listen to this episode once again and gather your information with your pens and paper. But need custom workflows or team trainings? Email me, call me, get scheduled today, put on my calendar. I will be more than happy to help. And remember that policies are like houseplants. You must care for them regularly and stop pretending the wilted one in the corner just needs more light. No, it needs work. It needs love, attention, and support. So this has been Behavioral Health Talks with your behavioral health queen, Dr. TK. Go ahead and make sure you follow me on TikTok at Never Feed the Beast for micro lessons, leadership insights, and compliance content with personality. All cited material, research, and policies references and available in the show notes and on the website. So until next time, never feed the beast, never fed the beast. Work hard, stay peaceful, and remember, we are working to have roots of resilience. Strengthen your foundation, thrive in adversity. And until next time, you guys be great.